Hi, I'm Dr Anthea Rhodes, paediatrician here at the Royal Children's Hospital in Melbourne, and your host today on the Kids Health Info podcast. In our current series, we're talking to some specialists from our emergency department downstairs about things they commonly see. And with summer just around the corner, bites and stings are definitely on the list. So joining us today, we've got Dr Tristan Harding, one of our ED specialists, to help bust some myths and give us some advice about how parents can manage these common and sometimes serious issues. Thanks for joining us, Tristan.
Thanks for having me, Anthea.
From the Royal Children's Hospital Melbourne, this is the Kids Health Info podcast.
So bites and stings, does this bring kids into the emergency department?
It does. In fact, my first patient I saw downstairs in the emergency department today had a spider bite.
Tell us a bit more about that.
So we see patients coming in with bites quite a lot of the time. Often parents don't know what has bitten their child, and it's just we notice this spot or we notice that something's swollen. And for us, most of the time, patients are able to be reassured and sent home. There's only a couple of times we're ever worried about bites and stings.
Okay, so maybe we'll talk a little bit about that. How do parents identify what might have stung their child? Because it is really common that perhaps your child starts crying, they're itchy, you notice a red spot, and the chances of you having actually seen that bite happen are quite low.
Yeah, very low. And often we don't identify what's going on. We do know that if parents are with their child outdoors, it's much more likely they'll be able to identify if it was a wasp or a snake or something like that. But a lot of bites tend to occur overnight when children are in bed asleep, and usually those are low risk and don't have any significant consequences for the family.
Okay, so what might be some of the clues to look for? What do you look for example? This patient who came today and they said, we've got a bite, we're not sure what's happened. What are you looking for to help you work out what's caused that bite?
So usually we get an area around the bite that's a little bit red, a little bit swollen, but the child can still use that affected part of the body. So in today's case, it was on the hand, but the child was still able to use their hand to feed themselves normally. These ones, the swelling will disappear after 24 to 48 hours, whether it's from a spider or a mosquito. And we can help their symptoms with some simple pain relief or even antihistamines if they're itching.
And what about the bite marks can help give you a clue?
So usually really small bites that are hard to see are often from mosquitoes. Spider bites can be a little bit bigger sometimes and you can see the actual entry point to the skin, but usually there's just a single bite in that one spot. Mosquitoes might bite in multiple places, so you might get multiple wounds.
Okay, so tell us a bit more about spiders particularly. You've mentioned you saw one of these just today. So spider bites are one of those things that sometimes we feel might be serious. There's actually lots of myths out there about what can happen if you get bitten by a spider. So thinking mostly about here in Victoria, what is it that we have to look out for?
So in Victoria, there's only really two types of spiders we worry about. One's the white-tailed spider and one's the redback. Generally, these are found out in wood piles or in more rural areas, and we don't tend to see many of them in metropolitan areas. And usually they're quite distinctive, so you can identify them by their colour. So the black spider with a red area on their back for the redback, and the white-tailed spider has quite a distinctive white body as well. Both of those are rare and we don't tend to see bites, but they usually cause a much more significant area of swelling on the part of the body that's been affected, and often they can swell up to cause significant pain as well.
What about funnel webs?
Fortunately for us here in Victoria, funnel webs aren't common. We normally see them anywhere north of around about Sydney. So if you are or have been travelling to those areas and have been bitten by a spider, it is worth seeking medical attention, particularly if you do get those signs like a big wound or a pus around the site. And actually on that note, if you do happen to see what type of spider has bitten the child, if you can get a photo, it does help with us identifying and treating.
Okay. And does any special treatment have to be given, anti-venom, that sort of thing, for these types of bites?
We normally don't give anti-venom for spider bites, but we might need to treat with antibiotics if the wound was to become infected. So sometimes those ones, you might see what looks like a pimple around the side of the bite. And if the child's not able to use that part of the body, so can't use their hand or it's so swollen, that might need some antibiotics through a drip just to help settle it down.
Okay, so moving on to some of the other insects, while we're talking about insects, you mentioned mosquitoes, and as you said, often multiple mosquito bites might be a clue that that's what's caused that particular bite. Tell us what we need to look out for and what some good treatment options are for this.
So mosquitoes are far more common it's this time of the year heading into summer, and often we see them come out at dusk or overnight. We often find children get bitten in multiple places, and you can prevent it to some extent with some of the repellent sprays. In younger children and babies, we don't recommend applying those directly to the skin. We'd recommend putting it on their clothing to try and deter the insects. But equally for babies and young children, we try and have them protected by either some netting over their pram, if that was applicable, or if we're having the children inside with doors open, not turning on lights until all the doors are shut, fly screens are up and things like that.
So that sort of, I guess, advice that they're attracted to light is true?
It is. There certainly is for mosquitoes. So yeah, try and minimise that interaction around that time of the day, dusk and going into the evening.
Okay, and you mentioned deterrents. So there's a few products out there. DEET is one of the key ingredients that's included in some of these products. Is it safe for children to have this on their skin?
So DEET is safe, but it is quite strong. So we recommend a strength that's 10% or less for children because it can cause irritation to the skin and can actually cause effects to the whole body as well.
And you mentioned for young babies having it on the clothing or perhaps, the bedding as another deterrent being a great tip as well.
Indeed.
So if your child has been bitten by mosquitoes, and most children out there at some point have, I imagine, I know I've had some rough nights with my kids itching and being bitten by mosquitoes, what can you do about managing that?
So there's probably two main things that help more than anything else. Antihistamines can be great for the itching because it'll switch off that reflex to want to scratch at the wound. But equally, some lotions or creams can help to settle down the skin as well where it's been bitten.
Okay, and remembering, of course, that antihistamines are over-the-counter from chemists and chewable tablets and syrups are good options for younger children for these.
They are.
What about pain relief? Is there a role for that?
Definitely. So pain relief is really good at the time around where the patient's been bitten and for the next sort of 24 hours or so because they can be more irritable or find it harder to sleep if they've got multiple wounds on their body.
And you've mentioned that sometimes you might even see kids in an emergency department with mosquito bites. Would there be a situation where you really do need to go to hospital?
It's rare, but some children can have reactions to bites. And usually the skin around the wound or around the bite will become quite red, quite swollen and quite painful. It is uncommon to see that, but if children are scratching at their wounds, they can actually cause a bug to get into the skin and that might need some antibiotics and that is called cellulitis.
Okay, and so in some cases, rarely you might need to be at hospital, but often the local doctor is probably a good person to see to help you sort that out.
Correct.
So obviously getting a mosquito bite or multiple mosquito bites is a bit pesky and irritating. But what about the risk of actually contracting a more serious illness, a virus, for example, or malaria as a result of being bitten by mosquitoes?
We often get asked that question in emergency, could this be malaria or other similar diseases that are borne by mosquitoes? Fortunately, in Victoria, the chance of that is incredibly low. Things like malaria or dengue are transmitted only overseas and not within this country. And other viral infections that can be transmitted by mosquitoes, we don't tend to see here in Victoria.
Okay, so perhaps if people are travelling overseas for holidays, this is something to talk about with your local doctor before you go to understand what sort of protection or precautions you need. Or if you've returned from a holiday and you're unwell and your child's had lots of bites, then that would be a reason to, again, see the doctor for some advice.
Yes, and we want to know that information when you return.
Okay, so moving on to the next insect on the list, I'm thinking about bees and wasps. They look similar, but are they really?
We get much more concerned about wasps, particularly at this time of the year in summer, because wasps can cause a reaction called anaphylaxis. And anaphylaxis is a severe, life-threatening reaction where you might get sudden onset vomiting or shortness of breath, or even children who feel pale and nearly faint. And that needs emergency medication. We give adrenaline, and that can be given by the ambulance or by us here in hospital.
And what about bees? Can children have a similar reaction to bee stings?
Children can react to bees, but it's not as common. So bees generally will cause a local reaction on the skin, but won't cause that significant threat of anaphylaxis.
And one of the things that we do get questions about sometimes as well is, should you remove the sting or not?
So we would try to remove it if possible, but rather than pinching it and trying to pull it out, that can actually release more venom into the skin and worsen the reaction. So we'd recommend trying to flick or scrape it off the skin instead.
And a really good trick I've actually seen is with a credit card as being a nice, neat way of trying to scrape that sting out. And as you say, really avoiding squeezing it to make sure you don't make things worse.
Exactly.
All right, so we've talked about some of those bites and stings from insects. Obviously, there's many insects, but we might move on to some other critters now. Coming into summer, one of the things that we start to see around, particularly in this spring season, is snakes. Now, here in Australia, we know we do have some seriously venomous snakes.
We do. So in Victoria, the two types of snakes we worry most about are brown snakes and tiger snakes. And whilst they are rare at this time of the year, as the weather warms up, they start to come out of hibernation and lie in the sun. And often they're around our walking tracks and bike tracks where children spend a lot of their summer holidays.
So what sort of advice have you got for parents if they feel concerned that their child has been bitten by a snake? They may or may not be sure about that happening, or perhaps another child, they're out playing and someone comes running in and reports that they've been bitten.
So I guess the first thing is to check if anyone actually saw the snake biting or the child. We do find that it's common that other things can be mistaken for snakes, and we commonly get false alarms, and that's okay. We'd far prefer that over a child actually being bitten. But normally if a child has been bitten, we'd often see 2 puncture marks close together that might have an evidence of some bleeding around that site.
Okay, and what's the first aid? If that happens at home and you think it might be a snake bite, what do you do?
So the most important thing is to try and stop the child from moving and put a pressure bandage on their leg. If you have bandages, great. Often we don't when we're out and about in the country or out walking. So putting something tight, like tying up their a T-shirt or something around their leg where the bite has occurred, and trying to just keep them from moving as much as possible.
And why are we doing that? What's the point of doing that?
So the main thing is we don't want that venom, if it has gone into the skin, to spread up the leg into the rest of the body. So we're trying to localise it to that one part of the body. The most important thing, if we do suspect someone's been bitten by a snake, they do need urgent medical attention. So if you're able to safely get them to their local emergency department, that would be great. But if not, call an ambulance and they can help with that as well.
Okay, so really take it seriously and take that immediate first aid action. You don't want to sort of second guess the possibility of a snake bite.
Correct. And I would say if anyone is able to safely get a photo of the snake if it was still available, that helps with our decision making for giving anti-venom. But if you don't, please be safe and don't risk any further bites from that snake.
Okay. So on to the next thing. It's all starting to sound like it's a bit wild out there. What about jellyfish? So in Australia, lots of people spending time at the beach. There might be slightly different advice depending on whether you're in a more tropical area or here in Victoria where it's rarely tropical, but it does get warm enough to be at the beach. What are the risks there?
So we are lucky in Victoria that a lot of our jellyfish and other marine critters don't cause any serious injuries. The jellyfish we see might cause local skin irritation, but don't cause anything more serious than that. They're painful and they're annoying, but they can just be treated with local pain relief like paracetamol.
And I think this is one of those things where there's quite a lot of maybe myths or, misbeliefs about what to do. So I'm going to ask you a few questions about whether you do or don't put these things on a jellyfish sting. What about vinegar?
So in Victoria, our jellyfish aren't serious with their stings, and so we don't need to apply vinegar here. In tropical areas like Queensland, north of about Cairns, we might find box jellyfish, and those ones can be much more dangerous, and those ones we might need the vinegar to try and change the sort of acidity of the bite or the sting on the skin.
Okay, so locally in Victoria, don't necessarily need to rush to vinegar, but it might have a role if you're in a tropical area.
Correct.
What about hot water? Definitely people talk about soaking the arm or the foot in hot water.
I'm always concerned about people using hot water to treat wounds. One of the risks is actually causing more damage to the skin because if the water's too hot, it can actually cause a burn, and that's worse than the sting was in the first place.
So what about ice?
I actually find ice just as bad. Sometimes ice can also cause a cold burn and cause trauma to the skin. So I'd recommend cool running water if it's available, or just using the actual ocean to your advantage. So swirling the arm, if that's what's been stung, around in the water for 10 to 20 minutes to sort of flush out the wound. That can help as well and provide some pain relief.
Okay. And here's a tricky one. What about urine? Sometimes people talk about actually weeing on a jellyfish sting.
I've heard that rumour many times. Unfortunately, in Victoria, that's not necessary for most of the jellyfish we see. In northern areas of Queensland, where we do have those box jellyfish, that could work, but only if there's no vinegar available or other first aid methods.
Okay, so we'll steer clear of the urine on Victorian beaches if a jellyfish is around. And it sounds like cool running water, or perhaps the ocean water, if that's what's available, is going to be a pretty reliable first aid measure in most of these cases.
Correct, yeah.
Thanks so much for covering all those various bites and stings, Tristan. It sort of makes you feel like, we go outside, there's so many things out there. But fortunately, most of the more common bites and stings are pretty mild and the more serious things are rare. So for people listening at home, just recap for us the first aid for most of those common bites and stings. General advice.
Yeah, most of the bites and stings we see can stay at home safely. So things that can help is cleaning the wound with cold or cool running water, using antihistamines if it's itchy, using some pain relief if it's sore, using some antiseptics or some creams. And a good place to go to get these is your local pharmacy, who can provide advice on what to use for what type of bite.
And most of the time that will be enough. But of course, we've also talked about some of those more serious things. When is it really an emergency in the case of a bite or sting? And what should they do then?
So any bite or sting that I get worried about is anything that might cause anaphylaxis. So where you get sudden onset, shortness of breath or difficulty breathing, coughing fits, extreme itchiness, or even vomiting. So in the case of any of that, I'd recommend going to your local emergency department immediately or calling an ambulance.
And of course, snake bite's one of those ones to take seriously too.
Absolutely.
Thanks so much, Tristan. Lots of practical tips there for parents at home to help them stay safe this summer. It's been great to chat with you today.
Thanks, Anthea. Stay safe and enjoy your summer.
Thank you. You too.
Information in this podcast is general in nature and is intended to support, not replace, discussions with your doctor or healthcare professional. If you have concerns about your child, please consult your local healthcare professional for individual advice. This podcast is recorded on the traditional lands of the Wurundjeri people of the Kulin Nation, and we pay respects to their elders. Kids Health Info is funded thanks to the support of the Royal Children's Hospital Good Friday Appeal.